Hi guys, welcome back to the Friday Q&A, talking about topics in medical dermatology. As you can tell from the title and thumbnail of this video, today I'm going to cover the topic of warts and all of your questions about warts. And specifically in this video, I'm going to cover common treatments for warts, things you should know about dealing with warts, and some tips for going about taking care of warts to help them go away a lot faster. But first of all, what causes warts? Warts are a very common skin growth that are caused by the human papillomavirus. Now, I know what you're thinking. Human papillomavirus, or HPV, isn't that what is associated with cervical cancer and causes cervical cancer? And you should know that there are over 100 different types of HPV. And some types are high risk for cancers, and other types cause pesky things like warts, which we're going to be talking about today. But warts are a little infection, a little HPV infection in the very top layer of the skin, in the epidermis. And the infection is the result of usually skin-to-skin contact. You know, for example, if you shake hands with somebody who has a wart, children playing together, tumbling around, their skin comes in contact with one another and they can transfer warts back and forth. And they can be introduced into tiny little cracks in the skin and subsequently take over and form this wart. How do they do it? They infect the skin cells called the keratinocytes, and they hijack the biology in those cells and force the cells to proliferate at an increased rate and make a lot of keratin. So as a result, you get this thick, bumpy, unsightly, warty thing that you want to get rid of. That's why you're watching this video. Then there are another type of warts called flat warts that can happen on the face and on the shins. Oftentimes in women who shave their legs, or in men shaving their face, because you make little tiny micro tears in the skin and then you introduce more warts into neighboring skin. So flat warts look a little bit different. The other demographic who is commonly afflicted by warts are people with dry skin, people with eczema. And the reason being is that in eczema and in dry skin, we have an impaired skin barrier. And that impaired skin barrier subsequently is more susceptible to virus infection. Then the other demographic of people who develop warts, and warts that are really stubborn, are people who smoke, tobacco smokers. Tobacco smoke is immunosuppressive, and our immune system and otherwise healthy people eventually, albeit slowly, will get rid of wart viruses. But in tobacco smokers, that is really, really delayed. And then in that same vein of immunosuppressed people are people who are immunosuppressed either because of medications that they're taking, like prednisone or something called azathioprine or Imuran, cyclosporin. These people have lowered immune systems because of the medications they're taking, and as a result, they don't clear warts and are more susceptible to warts. People with HIV infection are also very susceptible to warts, and people who have had organ transplants take medicines to suppress their immune system so that they don't reject the organ. They are very, very susceptible to incredibly stubborn warts. But in the general population, anyone can get a wart, and they take a long time to go away. Regardless of how healthy you are, they can take a really long time, and nobody wants to deal with them. One of the things that you as a sufferer with warts should be aware of is that if you pick a wart or scratch it, you can actually, theoretically, and it's been posited, you can actually inoculate more wart virus into neighboring unaffected areas of skin, particularly if you've got eczema and that neighboring skin is impaired, particularly if you've got dry skin. So don't pick a wart. It's really hard, but picking a wart actually can subsequently make other warts pop up. But what can you do about warts and how to get rid of them? Well, the first thing that you should do, as I always say in all of my videos, is to see your treating healthcare provider, confirm it is a wart, okay? There are other things on the skin that look an awful lot like warts and are not that. You know, there are things like skin tags, for example, that are not viral warts. There are other little skin things. There are skin cancers. So make sure that you are dealing with a true wart. But many warts just will regress on their own, albeit slowly. All right, so next up, seeing the dermatologist, what can they do? Well, a lot of the treatments in dermatology for warts are aimed to kind of agitate them and get the body's immune system sort of revved up to come in and recognize and clear that wart virus. They include destructive techniques like freezing the wart or cryotherapy. There's also, for really, really big honkin' warts, sometimes the dermatologist, we can actually scrape out the wart and burn the base. This tends to have a high recurrence rate and can also lead to a scar. So it's only sort of reserved for really, really stubborn big warts that may be just uncomfortable or in areas of the body that aren't as apparent, where a scar would be more acceptable. Then there are a variety of things that can be injected into warts to make the body kind of angry at the wart and the immune system come in and try and clear it out. These include things like Candida, which is an antigen that the body can react to, and they can really work quite well to clear the wart. There are also a variety of creams that can be prescribed to help get rid of warts. One such cream is something called Iniquimod or Aldera. This functions in the immune system to help clear the wart virus. There's also another prescription cream called Effudex or 5-fluorouracil. This can agitate the wart and help to clear it a little bit faster. Another option is a topical retinoid like tretinoin cream or over-the-counter Differin applied exclusively to the wart. That can potentially help depending on the thickness of the wart. Really, really thick warts, it's hard to get the tretinoin and the Differin, the retinoid in there, but they can be helpful, particularly for warts on flat warts on the face or on the hands or on the shins. What you need to understand is that there's no universally effective treatment out there for warts, and it's kind of a commitment on your part. For example, cryotherapy or the liquid freezing spray done in a dermatologist's office, that typically has to be done every 1 to 2 weeks, and that's quite a commitment on your part. It's got about a 70% success rate after somewhere around 3 or 4 months. So it's not perfect, and again, it depends on the location. Warts on the bottom of the feet treated with cryotherapy tend to not respond because the skin there is so thick to begin with that it's difficult to direct the freezing spray into the bulk of that lesion to affect clearance of the wart. But that's something for you to be aware of. It takes time, it takes multiple treatments, and really what they're doing is increasing the body's response to the wart and helping it go away faster. But as far as things that you can do at home to help the wart go away a little bit faster, the at-home liquid freezing sprays, at least in my experience, I have just not found to be helpful whatsoever. I think you know what I'm talking about. I get questions about these all the time. It's a spray you can buy over the counter that is freeze away, or they have different names. I just don't find them to be useful or effective. If you do try one out, make sure you follow the directions very carefully. Try to not, go treating a broad area, because like I said, any injury or breaks in the neighboring skin can kind of put you at risk for getting more warts in those areas. So really, really follow the instructions carefully. But like I said, in my experience, I just don't find those at-home freezing sprays to be worth anyone's time. The way to take care of a wart, though, is to do a consistent routine on the wart. It requires consistency on your part. So these tips I'm going to tell you now, you can do on your own, or you can do on your own alongside treatments that you're getting from your dermatologist. So, and if you do this routine along with those, it will increase the chances that you'll have a good response to those treatments. All right, at nighttime, what you want to do is soak the wart and get it soft. You may take a shower at nighttime, get the skin wet. You want to soak the wart, particularly those big, thick thick, clumpy warts. Soften it up really well with water. You can even soak it with a wet gauze. Get it good and wet and soft. And then you want to come on with like a nail file board or an emery board or even a small pumice stone, and very, very gently file the wart flat. And the reason for this is that the next step is going to be to apply an over-the-counter salicylic acid treatment. And that over-the-counter salicylic acid treatment does not have any chance and stink in working if you put it on a big heaping cauliflower wart, okay? So file the wart down very, very carefully. After you file the wart down very, very carefully, the soft wart, see, this is why you have to soften it. Otherwise, it's kind of difficult to go sanding it. After you file it down very, very carefully, then what you're going to do is to apply an over-the-counter salicylic acid wart treatment, okay? And down in the description box, I will list some of my favorites. Some of them are better served on thick areas of the body, like the feet, the soles of the feet, the palms. And I will specify which is which, whereas others are a slightly lower percentage strength of salicylic acid and are better tolerated on thinner areas of the skin, like the arms or the face, for example. Okay, so then you want to apply one of these agents, whether it be, one of my favorites is duofilm. That's fine for areas of the body or the face. It's like 17% salicylic acid. You just paint on a little thin film, and you want to be very, very precise with putting the salicylic acid just on the wart, because you don't want to go irritating the neighboring skin with the salicylic acid. And what this is going to do is going to just keep the wart thin and keep it from getting thick and clumpy and help it to go away faster. After you apply the salicylic acid, then you want to cover the wart, okay? You want to occlude that salicylic acid onto the wart. You want to drive it into the wart. And you can do that with a Band-Aid. You can do that with tape. One of the best things, though, to do is to cover it with duct tape. They've even done studies on this. Cover it with duct tape because it's very, very, very sticky and tacky, all right? So cover it up, and then you go to bed like that, all right? And then the following morning, you can rip that duct tape off, and that mechanical action of ripping further helps to agitate the wart and bring in the immune system and help to clear it, okay? But doing that routine with the salicylic acid and the duct tape and soaking the wart, I'll list the steps down below for you guys, but doing that routine on a nightly basis, 70% of warts will clear in 12 weeks, and assuming that you're otherwise healthy and not not immunosuppressed or not somebody who's smoking, 70% will clear within 12 weeks. And if you're already going to the dermatologist and getting the freezing spray and you're also doing this, it will make them go away even faster potentially. As I have talked about in my pregnancy skincare video, for those of you out there who are pregnant, salicylic acid is not, unfortunately, topical salicylic acid, particularly the high concentrations in wart products, is not recommended in pregnancy. So you have to skip the salicylic acid, but you can still use duct tape. That appears to be safe in pregnancy. You can still file it down. You can still, soak it, file it down, and cover it up with a piece of duct tape and then rip it off. Even that mechanical ripping off and filing will help it go away faster. So if you're pregnant, just skip the salicylic acid step. How much of a difference it makes, who knows, but yeah, that would be my tip for those of you out there who are pregnant, is to just skip the salicylic acid products and just do the duct tape. It can be helpful. But anyways, guys, I hope this video was helpful to you guys and kind of going over a little bit about the biology of how warts occur, what you should know about them, common treatments for them, and things that you can do, practical things that you can do at home and can do proactively to help them go away faster. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. Talk to you guys